Hi, my name is Joe Ebner. I am the Chief Medical Officer at Speare Memorial Hospital in Plymouth, New Hampshire. Today's date is February 4th, 2022, and this is a COVID update intended for the greater Plymouth community of central New Hampshire. I believe at this point in time, we are on the downward side of the Omicron spike. By and large, this has been the largest spike New Hampshire faced during this COVID pandemic. Since the early spring of 2020, when the COVID pandemic spread across the world, New Hampshire experienced one spike for about 1 month in time in December of 2020, in which time about 1,000 or so New Hampshire residents were diagnosed with COVID each day. We are finishing up our second spike that started in December of 2021, where we were experiencing between 2,000 and 4,000 residents a day being diagnosed with COVID, and at times up to 5,000. This has been for the last couple of months, and you may have noticed an increase in family and friends being diagnosed with COVID during this time. The last couple of months, the New Hampshire hospitals have experienced unprecedented hospital volume, not all because of COVID. There were times, though, that nearly 500 patients were admitted to New Hampshire hospitals with COVID. But that is not the only thing that affected our volume. The other problem that we're experiencing is workforce shortages. Just as you might be at home caring for a loved one with COVID, or maybe at home during periods of quarantine, this also affected our workforce across the state. For whatever the reason, our New Hampshire hospitals have been extremely full for the last couple of months. There were times when we had to transfer patients to Maine, Connecticut, or even to New York to find a staffed hospital bed. There was a brief period of time, locally here at Speare Hospital, when we had more than 30 inpatients admitted to our 25-bed hospital. During these couple of days in mid-January, we did temporarily convert part of our operating room department into a new hospital ward to take care of sick patients. During this time, we did have to close to elective surgery and restrict our visitors to the hospital, period. Not all of this increase in volume was due to COVID. There were times where we had 7 or 8 COVID patients admitted to our hospital, where we typically range 1 to 4. The senior hospital team and I are so very proud of all of the employees at the hospital. Our small size proved nimble enough to care and to accomplish great things during that period. In less than 24 hours, we were able to convert an area of the hospital normally designed for outpatient operating room care to an inpatient unit, staffed 24/7 with nurses, physicians, and respiratory technologists. In addition to the direct care providers, we also had to staff up for linen, beds, housekeeping, meals, and food. There was no part of the hospital that did not participate in this Code Purple, as it's called. I am happy to say that through this period, our infection prevention team kept us all safe, thereby keeping all of you safe. There was no spread of any infection and no clusters even during this period of heavy volume. Our infection prevention and employee health team continue to keep us safe so that you can feel confident accessing care at Speare. Speare requires COVID vaccination of all of its employees, and up to 70% remain up to date on the recent boosters. Some people are not yet eligible for the booster or may have recently been infected with COVID and their booster is on hold. We all answer a daily health questionnaire designed to identify those people at risk from their symptoms who may have COVID. We also wear a mask and shield during all inpatient care. For those employees the few employees who've been granted religious or medical exemptions to vaccines. They also undergo weekly testing to detect any asymptomatic carrier status. As of yesterday, New Hampshire hospitals had 244 hospitalized patients with COVID. This is down from the nearly 500 that we saw last month during the Omicron variant. Omicron did change things compared to previous hospitalized patients in that only about 40% of those hospitalized were not vaccinated. Previously, this number had been much higher. But one thing we do know is that those who are fully or partially vaccinated, what we now term up to date with their COVID vaccine, were less sick, less likely to be in the ICU, experienced a shorter stay in the hospital if they needed hospitalization at all. Currently at Speare, our operating rooms are back to up and running. Our operations have returned to normal. We have open beds and also plenty of beds around the state to refer sick patients to if needed. We hope that, like previous springs, we see a bit of a drop in the amount of COVID circulating in our community. All of us need that little reprieve. If, however, you are feeling sick, fevers or chills, cough or shortness of breath, fatigue, aches, headache, loss of taste or smell, sore throat, congestion, runny nose, nausea, vomiting, or diarrhea, please get tested, even if you have the vaccine. There are free at-home tests that can be ordered from the CDC website. These take about 7 to 12 days to ship. There are also limited testing available at local pharmacies, such as CVS and Rite Aid. Appointments are needed. If you look on the screen now, Midstate Health Center and Speare Memorial Hospital both offer curbside COVID testing. Midstate offers it from Monday through Friday from 7:30 to 12. Accessing their website or calling 536-4000 option 8 can help get you that appointment. Speare Hospital offers testing Monday through Friday from 8 to 12, and on Saturday and Sunday Speare Hospital offers testing Monday through Friday from 8 to 2, and on Saturday and Sunday from 8 to 12. Accessing SpeareHospital.com or calling 536-1120 can help facilitate making that appointment. If it turns out you do have COVID, please stay at home. Stay at home for 10 days from the time you began to experience symptoms and until you are fever-free for over 24 hours and your symptoms are improving. Please also call your doctor. You may be eligible for treatment to prevent your COVID from getting worse. There are limited amounts of oral and IV medications that can be used to decrease COVID exacerbations if given early in time. These are changing nearly weekly, and the amount that we receive from the federal government to Speare changes from week to week. Everybody's eligible for this, and what we do is prioritize those most in need and administer these medications until the supply runs out each week. As the science changes, these medicines will change, and so will their supply. Your local physician can order one of these medications for you through Speare Memorial Hospital, but only if you give them a call first if you are tested positive for COVID. When should you seek emergency care? You should seek care anytime you're having trouble breathing, persistent pain or pressure in your chest, if you're newly confused, or if you have an inability to awaken or stay awake. If you appear pale, gray, or blue in the skin around your lips or your nail beds, these are certainly reasons to seek emergency care. How can you stay safe during the remainder of this pandemic? According to the CDC, we should continue to wash our hands often, especially after being in public spaces, blowing our noses, coughing, or sneezing. We should cover our mouths and nose with a cloth face covering when around others. We should socially distance more than 6 feet from each other and avoid indoor crowds. And lastly, get vaccinated and boosted when offered. Just some comments on the vaccination. We cannot claim that vaccines will rid the world of COVID. As a living organism, COVID will run its course as other pandemics have in the past. Because this virus is active all over the globe, there's no way that we can rid this by vaccinating all Americans. However, remaining up to date with your COVID vaccine status will decrease your chance of serious illness and hospitalization and will decrease the spread to loved ones. I know that some of you have serious but transient side effects from the vaccine. I assure you, this is better than getting ill from COVID or having a loved one get ill from COVID. Thank you for making this sacrifice. You might be wondering, when is it time to get a booster? If you've recently had COVID, you will want to wait until you're feeling better and that your symptoms have resolved and that you're outside your isolation window. But any time after these couple of weeks, it is safe to get a booster shot. If it has been more than 5 months since either Pfizer or Moderna, it is time to get the booster vaccine. If it's been more than 2 months from the J&J Johnson vaccine, it is time to get the booster. Please stay up to date with your boosters and encourage friends and family to do the same. Locally, New Hampshire has a fixed site dispensing COVID vaccines. No appointment is necessary. They take walk-in appointments. It is located at 13 West Street in Ashland. It's the old New Hampshire liquor store off exit 24 near the Circle K Irving and the Burger King. This site is open Monday through Friday from 10 to 7 and on Saturdays from 9 to 2. They offer all 3 available vaccines, the Moderna, the Johnson & Johnson, and the Pfizer. Pfizer is available for all people ages 5 and up, while the Moderna and Johnson & Johnson are for adults 18 and up. As of January 22nd, looking at the available data, the CDC prefers Moderna and Pfizer if you have that opportunity. But any vaccine will be better than none. On behalf of the healthcare providers in our greater Plymouth community, I want to thank you for all the efforts over the last couple of years you've done to help keep each other safe and to help keep our healthcare system from being overrun. We were close during the month of January, but the healthcare providers across the state remain very hopeful that we are on the downward side of the Omicron surge. We certainly hope that spring and summer and fall will bring in a reprieve from what we've been experiencing over the last 2 months. We'll continue to follow the science. We'll continue to follow the data. Pharmaceutical companies will continue to produce vaccines and medications. So stay tuned as we work through this together. And at some point, the end will come. Until we talk again, stay safe.